Welcome back, everybody. Today is our office hours session for Subpart H. And we are going to be going over the exercise. We're going to go over the answers to the exercise, answer any questions that come up about that, and then any other questions that you have about the session yesterday. So please, like Sharita said, go into the Q&A box, type in any questions that you have. We're going to try to get through all of those. If we do get through all of those, then Les will talk about some of the questions that came in yesterday, or maybe there's some other concepts that people are still a little confused about, and we can explain those as well. So we're going to get started with the exercise. I'm going to show it on my screen, and depending on how big your screen is, you might need to scroll down to see the other questions. So there is a gray bar when you go to the right of what you see on the exercise, and when I scroll down, it does not change what's on the screen. So you're going to have to scroll down yourself to be able to see the other questions. And I'm going to go back and forth between the exercise and the slides, because I think it's really helpful for you to be able to see where some of this information is available in case you need to go back and find it yourself. Well, let's get started. The first question we have is how do HUD lead-based paint regulations work in tandem with the CDC and the EPA? And can we give some examples? Well, let's look at our slides. And I'm going to start like on slide 18. Yep, there we go. So the CDC, we have the Childhood Lead Poisoning Prevention Program, and HUD is using the confirmed lead level of 5 micrograms per deciliter, while the CDC recently lowered their reference value to 3.5 micrograms per deciliter. So HUD is going to continue to take action for their confirmed lead levels at 5 micrograms per deciliter at this time, but it could change in the future. So just be aware of the levels that we're at right now. All right, so let's look at how HUD works with EPA. We're going to go to slide 23, and if you recall this slide, this is where we talked about how the two different regulations work hand in hand with each other. So we'll first off, EPA's Subpart F, the lead disclosure rule, is actually identical to HUD's disclosure rule, so we have that one there. We have our DL and Q, our lead-based paint activities rule. That's really describing who the standards are for performing lead-based paint abatement, risk assessment, and inspections. And then we had our E and Q, our renovation, repair, and painting rule, and this is applying to almost all target housing, public and private, built before 1978, including child-occupied facilities such as schools and daycares. All right, let's look at question number 2. What projects or units must comply with the lead safe housing rule and are subject to federal, EPA, or HUD enforcement actions regarding lead-based paint? Well, HUD-assisted housing built before 1978 without exemptions, those need to be following the lead safe housing rule. We also, let me go back to my slides here. 30, we mentioned some of the key actors. So we have our owners and our property managers, and their maintenance employees are going to be subject to federal enforcement actions regarding compliance with lead safe housing rule. We talked about, if we go to the next slide, we talked about the EPA now having an even more, they're starting to do even more monitoring of property managers who are taking on the maintenance role to ensure that they have proper RRP training. Going back, we have our lead specialists, so we need to make sure if we're doing a risk assessment, we're doing someone who is trained as a risk assessor. Our clearance examiners are trained. We either have a clearance technician or we have a certified lead-based paint inspector or a risk assessor doing the clearance. Somebody had asked a question before we got started that was asking, can can the person who does the work also be the person that does the clearance? And the answer to that is no. We do need to have a separation between who does the work and who does the clearance. And it does need to be done by somebody who is following HUD protocols. You cannot just do an instant stick to see if it's clear or not. That's not allowed in HUD programs. So you do need to have a risk assessor or a lead-based paint inspector or a clearance technician do a full clearance exam of that area. All right, so let's look at question number 3. What are the types of vendors or contractors and their qualifications that a manager or an owner should have available to them or on call? And what will they be doing? Well, remember, first off, let's go to our summary chart. All right, so remember we have our evaluation, and so if we are up to including $5,000 per unit per year in single family, we're doing a visual assessment. And so we need someone who's trained as a visual assessor. That's that free HUD online training. So we want to have someone can be their own staff who's trained as a visual assessor. And then if you're over $5,000 per unit per year, that evaluation is then a risk assessment. So we need to have someone who's trained as a risk assessor to be able to do that risk assessment. They're assessing the paint, the dust, the soil lead hazards, and they're providing recommended mitigation options. And then when we get into if we identify any deteriorated paint, we need to be doing paint stabilization if we are up to including 5,000 or single family. So we're doing paint stabilization. We need to have RRP certified contractors and firms and renovators who do that work. If it's more than 5,000 per year, then we're doing interim controls. And so interim controls can also be done by someone who's trained as an RRP, so certified contractors, firms. And then we need to do clearance, and so clearance, again, needs to be a third party that's doing clearance, cannot be the same person that does that work or the same organization that's doing the work. So it could be a lead-based paint risk assessor, a certified lead-based paint inspector, or a lead sampling technician. And then where do we find these trainings? We do have a worker handout. Let me see if I can find that. Yep. So on the second page of the worker handout, it does provide some information here about our RRP workers, as well as our visual assessors. It has the link here on how to get to that visual assessment training. And then we also have on the first page, it talks about what these different groups can do. Let's see if I can. Barrett, you might need to mute yourself. I'm hearing a little bit of feedback. Thank you. All right, so on the first page of this document, you can also see, what can people, what kind of workers, what can they actually do? So we have our visual assessors, they can do our visual assessment. Our risk assessors can do risk assessment. They can do clearance as well. So this is a really good handout for you to go back to and look at as well. And this is our worker handout that we have. All right, let's go back to our exercise. We're up to question number 4. List some key steps and documents that the owner or the program operator has to implement to assure the units that they assist are in compliance. Well, we had that, back to my slides, we had that overview slide. Remember, these are the different steps that we have. And then we also had the summary chart. But going back to the steps, we have disclosure. So remember when we talked about disclosure, we were making sure that the owner was providing that pamphlet. They were providing the proper disclosure form, making sure it was being signed either at lease or before the lease was provided. They're getting that disclosure notice. And they're provided with tenant instructions on who to contact if they identify any deteriorated paint later on during the time they're living there. We also need to make sure that visual assessment is happening if we're in the property that has less than or equal to 5,000 per unit per year, or we're doing a risk assessment. That's a type of our evaluation. Then we have our treatment. Again, oops, we get to our treatment slide, sorry. Depending on the type of amount of funding or whether it's a single family, we have paint stabilization or we're doing interim controls. And then we're clearing the unit. We're doing notification, which is that lead hazard reduction notice. If there was changes, lead changes to the property, we're now also providing an updated disclosure notice to the tenant at lease renewal. And then we have ongoing maintenance, so reporting of any new evaluations, continuing inspections. There may be visual assessment. If you're in the over 5,000 per unit per year, you'll be doing a risk assessment every 2 years. And then if there's no additional hazards found, you could go back to a visual assessment and the disclosure notice as well. All right, let's look at our last question on this first part. How do you know if your organization is ready to meet compliance? Well, I think first coming to a training like this, making sure you're understanding what the requirements are, having some policies and procedures in place so that you're able to understand and know what the steps are, having sample forms available to use for your project or your program. If you're an owner, having a list of certified workers, who's going to be doing visual assessment, do they have the proper training, do you need to hire folks to do RRP, or are your own staff going to do RRP, that type of thing, and making sure you have a method for keeping documentation so that if you are ever monitored by the program or by HUD, you're able to provide documents to them. All right, let's look at our scenario. So our scenario here, we're doing, someone is moving out, so we're project-based assistance, obviously, and a tenant's moving out, and they've notified Cedar Properties of deteriorated paint on the ceiling due to water damage and large chips on the door frames. Cedar Properties was built in 1945 and immediately completed a risk assessment and lead-based paint inspection, which confirmed it was lead-based paint and verified the average assistance for the property is 6,000 per unit per year. What steps must be completed as Cedar Property completes the ceiling and the door frames? Well, first off, we want to figure out, does the lead safe housing rule apply? And so, you know, we know that first off it applies because it's pre-78. It was built in 1945. And it appears that the area we're working with is going to be larger than de minimis. So remember we talked about de minimis yesterday, 2 square feet of interior space, 10% of small component type, 20% square feet for exterior work. So the full lead rules for over 5,000 per unit per year are going to apply. So we are going to make sure they did a risk assessment so they know where the deteriorated paint and the lead-based paint is located, and the risk assessment should have also provided some recommendations on how to handle that, the lead-based paint, deteriorated paint. And so because we're in that higher area of over 5,000 per unit per year, we're going to be doing interim controls. Okay, so interim controls can be done by someone trained in RRP. It's a set of measures that's designed to reduce temporary human exposure or likely exposure to lead-based paint hazards. And it includes repairs, painting, temporary containment, specialized cleaning, clearance, ongoing maintenance, and the establishment and operation of management and resident education programs. So those are all different things that can be included in interim controls, but interim controls are the type of treatment that's going to be followed. Like I said, you need to have someone who is trained in RRP, so we need to make sure that we're getting the certifications from our workers, that they've been trained in RRP. And then after the work is done, we need to make sure that we're doing clearance. And so for clearance, we're making sure that we're looking, whoever's coming to do the clearance, remember, it can be a risk assessor, it can be a lead-based paint inspector, it can be a clearance technician. First, they're doing a visual to make sure that the area has been fully completed with the work, there's no dust and debris laying around, that it's been cleaned. So they're doing that, and then they're going to be doing some dust samples. So they're going to be taking swabs, doing those samples, sending those to a lab to ensure that it's passing clearance. They're going to send those to an accredited lab, and that lab is going to measure the residual lead dust clearance. The residual lead dust levels, and then they're going to get a report back, and the report is going to be interpreted to tell us whether it passed clearance or it didn't pass clearance. So we're hoping that it passed clearance. If it didn't, the work site needs to be re-cleaned again, and another clearance test needs to be conducted. So after that's done, then we need to provide the notice lead hazard reduction activities. This unit right now is not occupied because remember our tenant moved out, but if the tenant was still living there, we might have had to do some type of temporary relocation if it wasn't going to be safe for them to stay there, but we know that it's empty at this time. So this notice lead hazard reduction activities notice is going to be provided to the owner. They're going to have that in their file, and then we have ongoing maintenance. And so remember our ongoing maintenance after work was done, we're over here on the right side. So we're going to be doing a visual assessment the first year, the second year a risk assessment. So we need to hire a risk assessor to come do that risk assessment. Year 3 is a visual assessment. Year 4 is a risk assessment. If we have 2 consecutive times of a clean risk assessment, meaning there was not any additional lead-based paint hazards, then we can continue on with just visual assessments for those areas. The new disclosure notice, so when we do have our new household move in, they're going to be getting the disclosure notice that identifies that we knew there was lead in the unit, we used interim controls, here's a copy of those reports, so that's going to be provided. The owner is going to be keeping records of all this work that was done, as well as the clearance reports and the copies of the personnel who worked on that as well. And then just some additional resources if you need to look even deeper again in here. Like we said, we have the toolkit, and the toolkit has a whole section on project-based assistance and a lot of great sample forms. And then we also have our video, and we have a video on risk assessment, we have a video on clearance, there's a video on reports. So a number of these videos would be helpful to you while dealing with regular maintenance activities that would then trigger the lead safe housing rule. So that's the end of the exercise. Is there any questions that we should expand upon or answer a little more?
Well, the only question that we've had was the one that you answered, and I'm going to add one thing to that. Actually, Chris, since you've got control,
yeah.
If you flip to slide 67.
Okay.
So this is kind of pointing out, it goes back to that question, this key difference between the HUD lead safe housing rule and then the EPA. One of those points is that the HUD rule does require you to have this third party do the clearance testing as part of that. So, you know, this question about could the contractor themselves do that testing? Could they use a sort of a paint dauber test kit to be able to do that? And so that's one of the challenges, I think, sometimes on making sure that that when we're hiring the contractor to do any kind of treatment, that they understand that, oh, this is a project that is falling under the lead safe housing rule, and so the protocol that's going to be required is that we're going to have a third party that's going to be completing that testing. And so, you know, planning for that, we talked about thinking about having that procurement done for the risk assessor who's going to do the certification. Needs to be somebody different than that actual contractor themselves. But also, since in the case of project-based assistance, we're in many cases going to be turning to that owner and saying, okay, this is the treatment that's required. Here is who would be qualified to be able to do that. Here's the certification that needs to be in place, is making sure that they understand that when they are going to hire someone to do this, that they actually are following these requirements and that that's being called out for that. So I think it's a communication issue on that, and you may want to have a protocol where when the visual assessment or a risk assessment is being done, that when they do determine that there are lead hazards or hazards that need to be either paint stabilized or interim controls done, that you're sort of involved in that conversation enough to be able to caution them about who's able to do that and maybe have a little oversight to make sure that the person that's doing that does have the appropriate certification.
Great, thanks. There was another question that came in, Les, too, saying that they have documentation that their property is certified to be lead-free, and do they still need to do disclosure? And the answer to that is no. So if you have under a federal certification program or under a federally accredited state or tribal certificate program that it's been designated as lead-free, then the Lead Safe Housing Rule does not apply, including you do not need to do disclosure. But you do have to have documentation, because lead-free is different than lead-safe. So you do need to have that proper documentation that it is lead-free. And I did bring up the exemptions page here to show that. Les, anything else you want to add to that?
No, I think that covers it. I do think that it's that this, I think, is a good example as you're approaching a property to kind of go through this checklist of, well, what do we know about when was this property constructed? If it's after 1978 or it's after January 1st of 1978, then it's going to be exempt. So you would, we could define up front, if we're providing project-based assistance to a particular property, we could identify up front, are we going to need to follow the Lead Safe Housing Rule, or do we in fact have an exempt property? And you'd want to have the documentation on that. I think probably most folks would use the, you can use the county auditor's website, which I think when you get into the 1970s are good at identifying when that property was constructed. I will say earlier structures, it's not as dependable. But I think that would give you the documentation, because you oftentimes will have an owner that sort of has no idea when the property was constructed, and that might be a resource to look that up. But kind of going through that list of exemptions, including then asking the question of, is this a property that either has been inspected and found to be lead-free? We'd want to see that documentation. Or in the case of it actually has had an abatement where they actually removed the lead and it's now lead-free, as opposed to it has abatement that's been done and we still have some lead that's been contained in that. So if we go through our exemption list and are able to document that, then we won't have to follow through with exemptions. We won't have to go through our process on the visual assessment or our risk assessment for these properties. Otherwise, then we need to have a plan of action to be following those requirements. It looks like I can't, I want to get question thing. It looks like we've got new questions. I'm going to have to shut down our participant box to see that. Let's see. Okay, so there's a question about, and this kind of goes to the crux of a lot of yesterday's questions. There's a question about how do we determine how much assistance they will receive? How do we determine if it's up to or over? So the way this calculation is made, and Chris, actually, I think if you go to the subpart chart, or if you want to hand over Control. There we go. All right. So when we look at the subpart chart, and there are some things I want to point out here that relate to this question. Yesterday we had some examples that were asked, and they included when they identified that they had a single unit in a property that only included 4 units. So you'll see when we, let's see, you'll see in this definition in the category for up to 5,000 per unit per year and single-family properties. So single-family, our definition of single-family properties is 1 to 4 units. So in the case where you have project-based assistance in this property that qualifies as a single-family property because it's 4 units or less, you're always going to be in this category, meaning that you're going to be doing a visual assessment. So for those folks, you're not, for the single-family, qualifying single-family properties, you're not really needing to make that calculation because that's the category you're going to be in. Let me clear, there we go. So for the rest of you, then it's looking at, well, how do I determine which of these 2 categories I actually belong in? And there were a lot of questions that came through yesterday that I think may not have really been focused on project-based assistance because there was, you know, people were mentioning about, well, is it just the subsidy? Is it the rehab? So in this case where we're talking about project-based assistance, we are simply looking at the project-based assistance that's being provided for that property, the total for that property, and dividing it by the number of units that are being assisted to come up with an average per unit. And so then based on that averaging, we determine which of these protocols we're going to be following, whether we're doing a visual assessment or a risk assessment for this. So it's not including anything like, well, if I found you know, that there were hazards and I was going to do paint stabilization, is that somehow added into that calculation? No, we're doing that calculation on the front end on the level of project-based assistance that's being provided per unit per year for that property and coming up with an average. And that kind of then sets us on one of these 2 paths, whether we're going to be following on the up to 5,000 or whether we're looking at over 5,000 per unit. I do think we had a number of questions related to this yesterday that actually were kind of merging into where you were doing something other than project-based assistance. And so keep in mind, as Chris was showing yesterday when we went through this, and I think if we look at slide, oh, I need to get back to the slides to be able to do that. Let's go. So you'll see that based on the activity that you're undertaking, you would have then different standards, and we would be looking at those subparts. So I think in some of the examples, folks were actually doing rehabilitation on units as opposed to simply providing project-based assistance. And so those are going to fall under Subpart J, and we have a whole different set of requirements that you would need to be following. So first off, make sure that what we are working with is project-based assistance, and in those cases, then we're going to be following Subpart H for that. All right, let's see. There was also a question yesterday about would this also apply for private landlords? So I want to kind of pull that question apart a little bit. So because we're talking project-based assistance, and that includes project-based vouchers, we could have properties that are owned by a private owner that it's going to apply because we have assistance in that property. So those assisted units are going to trigger for those units the requirements under Subpart H. So you would be required, following Subpart H, to do what we talked about with the either visual assessment or risk assessments and following that protocol. But that only is applying to those assisted units for that property. So if the question is asking, does this apply to all private landlords? It does not, unless they have public assistance that's coming into under one of our subparts and triggering those requirements. Now, I will mention that in some communities, some states, that they have adopted some separate standards that are specific to that area. So you also would need to be aware of whether you perhaps locally have adopted some additional standards that would apply for those privately held units that are without assistance. Let's see. Go to slide 37. And so we had some questions about, and this kind of relates to what Chris was talking about earlier, about when might I be exempted from having to make the disclosure? And the key ones that we talked about, and a lot of these questions were related to, were when we had a lead-free unit. And so just want to reiterate that this has to be documented that it is lead-free, and we would need to have that documentation in place to be able to demonstrate why we are not providing those disclosures and following the rest of requirements under Subpart H, but also this key term of it's lead-free. So that means it never had lead in that unit, and our inspection is confirming that, or this is a property that has been abated and all lead has been removed from that property. So I think the key thing I want to convey is that not all abated properties are actually going to be lead-based paint free because they may have lead paint that has been contained following the abatement standards, but it's still not lead-free. So that's an important distinction on that. We had a couple of different questions on that, including folks that said, well, I'm pretty sure that this was done, but I don't have that documentation. You will need to have that documentation in place. So at that point, it might make sense to then pay for that inspection to be done to be able to determine that so that you would have that in place for future. Let's see. Chris, I think that's pretty much the questions that we have from yesterday that need to be reviewed. Looks like we've got a question that's just come in. Let's see. So they're asking, so when determining the average assistance per unit per year, do you calculate the last month times 12 divided by the number of contract units, or do you use the last year of your assistance divided by the number of units? And I don't know if there is any more specific guidance that's been provided. There is a public housing notice, a PIH notice that we mentioned earlier. Bruce or Karen, or do you know if there's more specific guidance on that calculation?
This is Bruce, and I'm not aware of any specific guidance for how to calculate it. I would think, since it's per annum, you just look at the last 12 months.
To me, that makes sense, yeah. Okay. I think that is answered the questions that have come in so far. So if there are more questions, please go ahead and put them into the Q&A box. Anything that Chris or any of the HUD folks would like to add since we have a little bit of time here?
One question just popped in, Les, and I think it's still adding to the confusion about is the cost of clearance part of that $5,000 threshold. So you might need to go over that again.
Yeah, so it's really important. So the calculation is based on the level of assistance the average per unit per year. So we're simply talking about that project-based assistance. We're not talking about the cost of any paint stabilization or interim controls that might need to be done. We're not talking about cost of clearance as part of that. We're simply looking at that project-based assistance. So it's sort of the level of HUD investment in this property to then determine the level of oversight that's going to be required. So it's strictly based on that project-based assistance, the rental assistance, not on any of these other costs that would be related to following Subpart H. I hope that helps with that. I think what may be confusing for folks that are also working under Subpart J, where you would be looking at total costs. That's a different subpart. It has a different calculation methodology, but specifically for Subpart H, since we're focused on project-based assistance, we're only looking at that project-based assistance, not these other costs, which actually are the responsibility of the owner for that.
Les, this is Karen. So I think you did mention it again in passing, but it struck me that perhaps we need discussion on what exactly the definition is of project-based assistance. So it's really, and I know we spent time on it yesterday, sort of at the outset of Subpart H discussion beyond disclosure and so forth. But our project-based assistance means, you know, how much HUD money is going into that particular project, meaning that house, that multifamily structure, units in that structure worth of subsidy for living. You know, it's really how much is HUD paying of that rent per annum per year.
And I actually was thinking about this earlier and pondering that we may have folks that simply have not dealt with project-based assistance before. So it's awarded to a property, and it might be for a few of the units, it might be for all of the units. And essentially what it's doing is that the tenant will be generally are going to be paying 30% of their household income and for rent and utilities, and this contract for the project-based assistance is going to make up that difference between that 30%, which is what is affordable for that household, and what actually the contract rent is for that unit. So that level of assistance, and that kind of goes back to that question about what are we using current month, are we using the last year, that depending on the tenant that occupies that assisted unit, that level of assistance is going to be recalculated based on what their income is. So what 30% of that household income, which is what it's affordable for them to be able to provide. So that level of assistance is going to change over time as the income or the tenant in those particular units change.
Right, but what doesn't change is once you determine which category you're in, unless if you want to bring up that summary chart, once you determine are you on the left side or the right side of the chart? So are you up to and including $5,000 per year or a single family property? You're on the left side. If you're over $5,000 per year, you need to follow the requirements on the right side. If you have any other additional questions, please make sure you go into the Q&A and type in those questions. We'll hang here for a couple more minutes. Happy to give you time back in your day, but if you do have questions about Subpart H, please go ahead and type those in.
I will just mention that we do have our third installation next week, which is Subpart L, which is for public housing. And so if that's a area that would apply to what you and your staff are doing, that might be one that you can still register for. So we have a question that's come in. So this person's kind of calculating. So if we've got a unit that's receiving $2,000 per month, if you multiply that times 12 to get your annual amount, then your average is going to be above 5,000, and so you're going to be then following our more stringent requirements on the right-hand side of our chart here. So we would then be doing risk assessment. We would be doing interim controls.
Yeah, and then the additional periodic reevaluations as well as that's another difference between the two sides. Plus, we got a pretty quiet group. I don't see any other new questions coming in. Maybe you should bring up that slide that has the email in case folks come up with a question later on. I think it's one of the last slides.
Yeah. Yeah, here we go. So as Chris is pointing out at the bottom of the page here, we have we have this email address. So if you have future questions, this is a way to be able to submit them and seek assistance on that. And particularly, case-specific things, it then allows you to be able to kind of describe and get answers specific to your project. Just as we're looking at this, I'll just also re-mention signing up for notifications under the HUD Exchange so that as any new tools or resources are available that you would be notified of that. And then as we mentioned, the HUD guidelines, chapter by chapter, will be very useful in seeking additional information, the videos that Chris and I have been talking about, and then specifically the toolkit, which covers each of the subparts, and then some cross-cutting things that would apply, such as EBLL children. I'll just also mention, as Chris said yesterday, we only had the opportunity to do a very quick review of what the required actions are when you have a child with an elevated blood lead level. So if you have not already attended that training in the past, that is posted, and I would really recommend that because that could be a responsibility that you would need to implement, and you would need to prepare and know what those required steps are. As Chris pointed out yesterday, there's pretty specific timelines on completing each of those required steps. So it would be important to, in advance, be up to speed on that and have a plan of action for that.
And Sharita has also put into the chat the link of where all the training materials are as well. If for some reason you're unable to access that or find the link earlier, it is in the chat for you to be able to access the slides and all the handouts.
I think with that, if we don't have additional questions, can give folks back a little bit of time in their day. And hope this was helpful, and just recommend that you utilize the resources from this training and reach out when you need assistance. Thanks, everybody, for participating. Bye-bye.